If you're over 60 and taking vitamins daily, you might be among the 89% of American seniors unknowingly harming their health. Some supplements marketed as healthy can damage your liver, stiffen arteries, and increase stroke risk by 25%. Comment your age below, and if you're over 60, I'll reply with a personalized vitamin safety plan tailored to your needs. What if the pills in your medicine cabinet, praised for vitality, are silently making you sicker, weaker, and more confused? As we age, our bodies change. Your liver filters toxins less efficiently, kidneys struggle to flush excess vitamins, and blood vessels become fragile. Vitamins safe in your 40s can become toxic traps after 65, piling up in your system and causing symptoms mistaken for aging, fatigue, brain fog, or joint pain. Studies from the European Journal of Clinical Nutrition show popular senior vitamins can accelerate aging, harm your heart, and cause nerve damage. But the right vitamins can reverse these effects, with one linked to a 36% lower risk of death from all causes, based on data from 42,000 seniors. Let's expose the 4 worst vitamins to avoid after 60 and the 4 you need daily to stay sharp and strong. Comment vitamins to receive a safe supplement list with dosages and timing. Before we start, comment which vitamins do you take daily? Have you noticed fatigue, confusion, or pain after taking them? Your answer might reveal what's stealing your vitality. I read every comment and reply with personalized advice. Worst vitamin number 4. Vitamin A, retinol form. Vitamin A in its retinol form, found in many multivitamins, turns toxic after 60. Comment vitamin A if you take it daily, as this is critical. Known for supporting eyes, skin, and immunity, vitamin A is essential, but only in the right form. Retinol, a fat-soluble vitamin, accumulates in your liver and fatty tissues, unlike water-soluble vitamins like C or B that flush out. After 60, your liver processes toxins slower, so excess retinol builds up, causing fatigue, joint pain, and a 25% higher risk of atrial fibrillation, per a 2022 European Heart Journal review, increasing stroke risk. Daily limits are 700 micrograms for women and 900 for men, but many senior multivitamins exceed this, putting you in the danger zone. For example, Susan, a 68-year-old retiree, took a retinol-heavy multivitamin and developed persistent fatigue and irregular heartbeats. Switching to beta-carotene-rich foods like sweet potatoes and carrots, which convert to vitamin A only as needed, eliminated her symptoms in months. Avoid retinol supplements and get vitamin A from foods like spinach or eggs for safety. Worst vitamin number 3. Iron supplements. Iron, marketed for energy, becomes toxic after 60. Comment iron if you take it, as this could save your health. Iron isn't easily excreted and accumulates in your liver, heart, and pancreas, causing oxidative stress that damages cells and ages tissues. Men stop losing iron after puberty, and women after menopause, so unless you have recent blood loss or diagnosed deficiency, extra iron is unnecessary. A 2018 Journal of Alzheimer's Disease study linked excess iron to higher dementia and heart disease risks, with symptoms like joint stiffness, fatigue, and brain fog often mistaken for aging. Mary, a 70-year-old, took iron for fatigue and developed memory issues and palpitations. Stopping iron and focusing on iron-rich foods like leafy greens under medical guidance normalized her symptoms. Most seniors don't need iron supplements. Check with your doctor and avoid multivitamins with added iron unless prescribed. Worst vitamin number 2. Calcium, without supporting nutrients. Calcium supplements, taken alone, can harm more than help after 60. Comment calcium if you take it daily, as this is urgent. Calcium strengthens bones when young, but after 60, bones absorb it less efficiently. Excess calcium deposits in arteries, increasing heart attack risk by 22%, per a 2016 Journal of the American Heart Association study, or in joints, causing stiffness. Calcium needs vitamin D3 for absorption, vitamin K2 to direct it to bones, and magnesium for balance. Without these, it hardens tissues harmfully. John, a 66-year-old, took calcium for osteoporosis but developed arterial stiffness and joint pain. Adding D3, K2, and magnesium redirected calcium to his bones, improving his heart health. Avoid standalone calcium supplements and choose balanced formulas or foods like dairy or kale, paired with these nutrients. Worst vitamin number 1. High-dose vitamin B6. High-dose vitamin B6, often in nerve support formulas, damages nerves after 60. Comment B6 if you take it, as this could prevent serious harm. Unlike other B vitamins, B6 accumulates in nerve tissue, becoming neurotoxic at high doses. A 2017 neurology study found seniors taking high-dose B6 had double the risk of nerve damage, with symptoms like tingling, numbness, poor balance, and brain fog mimicking aging. The safe limit is 100 mg daily, but even 50 mg over time can be toxic in older adults, whose livers clear toxins slower. Linda, a 73-year-old, took B6 for energy and developed hand numbness and falls. Reducing her dose and switching to B6-rich foods like chickpeas resolved her symptoms. Check your multivitamin and nerve formulas. Stay below 50 mg daily and consult your doctor. The best vitamins for seniors. Now, let's explore the 4 vitamins that restore strength, protect your heart, and sharpen memory. Comment ready for the best nutrients to thrive after 60. Best vitamin number 4. Magnesium. Magnesium rebuilds your body after 60. Comment magnesium for the ideal dose. Involved in over 300 biochemical reactions, magnesium supports heart rhythm, muscle function, nerve health, blood sugar, and bones. Aging reduces absorption, and medications like blood pressure pills deplete it faster. A 2018 circulation study linked magnesium deficiency to a 50% higher risk of atrial fibrillation, dementia, and diabetes. Symptoms like cramps, insomnia, or fatigue are often mistaken for aging. Correcting magnesium levels improves sleep, reduces cramps, sharpens memory, and stabilizes mood. Aim for 300 to 400 mg daily from supplements like magnesium citrate or foods like nuts and spinach. Robert, a 69-year-old, added magnesium and saw better sleep and fewer cramps in weeks. Best vitamin number 3. Vitamin D3. Vitamin D3, the sunshine nutrient, fights frailty. Comment D3 to add it to your routine. After 65, your skin makes 50% less D3 from sunlight, and indoor lifestyles worsen deficiency. D3 strengthens bones, muscles, immunity, and mood. A 2020 The Lancet review found low D3 levels raised respiratory infection risk by 50% and death risk by 30%. Symptoms include fatigue, low mood, or weak bones. Most multivitamins offer 400 to 800 IU, but seniors need 1,000 to 2,000 IU daily. Sarah, a 67-year-old, took 1,500 IU D3 and improved her energy and balance in months. Get D3 from supplements or fatty fish, and test levels with your doctor. Best vitamin number 2. Vitamin B12. B12 protects nerves and boosts brain health. Comment B12 if you're deficient. Up to 25% of seniors over 65 lack B12 due to reduced stomach acid and medications like antacids. B12 supports brain function, red blood cells, and muscle strength. Deficiency mimics dementia or neuropathy, with signs like fatigue, confusion, or tingling. An American Journal of Clinical Nutrition study showed B12 supplements improved memory in deficient seniors. Aim for 500 to 1,000 micrograms daily via supplements or fortified foods. Emma, a 71-year-old, corrected B12 deficiency and regained mental clarity in weeks. Test levels annually, especially if on acid-reducing drugs. Best vitamin number 1. Omega-3 fatty acids. Omega-3s are life-extending fats. Comment omega-3 for the best sources. Found in fish oil, they reduce inflammation, protect heart and brain health, and ease joint pain. A study of 42,000 seniors found high omega-3 levels cut death risk by 36%. They lower triglycerides, support memory, and protect DNA telomeres. Most seniors are deficient, eating too many inflammatory omega-6 oils. Aim for 1,000 to 2,000 milligrams daily from fish oil or fatty fish like salmon. David, a 70-year-old, added omega-3s and saw reduced joint pain and sharper focus in months. Balance omega-6 intake by limiting processed foods. Vitamins like retinol, iron, standalone calcium, and high-dose B6 can harm your liver, heart, and nerves, accelerating aging. But magnesium, D3, B12, and omega-3s restore vitality, protect your heart, and sharpen memory. Comment supplements for a preview of next week's guide on inflammatory supplements to avoid. Check your supplement labels, test nutrient levels with your doctor, and choose wisely. Swap retinol for beta-carotene, iron for greens, and add omega-3s. Small choices add years of strength and clarity. Share this with a senior who needs it and comment, which vitamins do you take? Did this list surprise you? Your health is in your hands. Supplement smartly to thrive.